Well, good morning, Gapsters. Welcome to March already, Coffee Talk. Moving right along in 2022. Appreciate everybody being here. I know that as we continue to try to make determinations on the best way to do things, we always appreciate your flexibility. So we are here today virtually, but hopefully that allows more people to join as well. I know some people have trouble getting there. This topic today is something that's actually really personal to me, and I'm so grateful to our presenter because she's been of a help. My parents live in Mississippi and talked to my dad about hospice forever, and he just, I'm not dying, leave me alone, I don't need that. It's like, but that's not what this is about. And now he does have hospice, and my mother can't stop raving about it. It's just such a big help. And we have just too many things that we don't know, or are misunderstandings or myths. And Gina has helped me with that. So I'm so thrilled to have her here today to share all of that kind of information with all of you as well. But before we jump into that, Camber, if you want to introduce our sponsors and give them a minute.
Yeah, absolutely. Hi, everyone. I'm Camber, and I am honored to be able to recognize our sponsors today. So Harmony at Hospice Works is here. We have Tanya and Charlene, and I'm going to give them a minute to speak in a moment. But Harmony has been a really just long-standing supporter of GAPS. We're so fortunate to have you guys on the team because really we wouldn't be able to do the work that we do without support like you. So Tanya, I'll hand it over to you, and then feel free to put your information in the chat as well. So if people want to, reach out later, but have a minute and just kind of introduce yourself.
Thank you. Well, thank you guys for having us. We love being a part of this group. It's near and dear to my heart as well. I'll just give you a little update about Harmony. So we are located in Simpsonville, right here in Five Forks. And what we do is we are a senior living community that has independent living apartments. We have assisted living for those who may need more help. And then we also have memory care. And as you mentioned, Lauren, near and dear to your heart with hospice and all, I actually worked with the hospice for about 3 years. And it 100% is not about dying at all. It's about living. And I've seen people graduate. So, but here at Harmony, we opened in 2017. We have a beautiful community where we provide a lot of activities. We have physical therapy on site. We also offer fine dining in our dining rooms. We provide 3 meals a day for assisted living and memory care. As independent living, we have 1 meal a day provided, but you can add a package for that. At Harmony, I've been with Harmony Senior Services since 2018. And the reason I chose to come here is because of the values that this company has, which is we're family focused. We have respect, integrity, our sincerity, our compassion and accountability. I've always said that I would never work somewhere if I didn't feel like my mom could actually live in the place that I work. Because our actual mission statement is to provide each of our residents, our family members, and our associates with the same care and compassion and respect that we would do our own family. So I believe in that every day. We hire for heart. And again, I believe those that work here with us, have the right heart and the passion and drive to help our residents every day. But I'm thankful for our partnerships, and we're here as far as a resource for you guys. Would love to have you guys come over at some point and see our community. But we definitely want to thank the GAPS group for all that you do and the support that you offer everyone. So thank you all.
Thank you, Tanya.
Appreciate that having you here. So let's quickly get started with our presentation today. Again, I mentioned Gina already. And some of you may be familiar. She's been at our socials and participated in our events, so her face may be familiar to you. She is the community relations liaison for Wren Hospice, and very well known in the community for lots of other things that she's done in the past. But I would like to get her started and then have an opportunity for you to have questions. So Gina, with that, welcome, and I will turn things over to you. Go ahead and get started with your PowerPoint whenever you're ready.
All righty. Okay, can everybody just give me a thumbs up if you can hear me? Okay, thank you so much for allowing me to be here today. Like Lauren said, I am the community liaison for Greenville County for Wren Hospice. We provide services in Anderson, Greenville, Spartanburg. We're actually licensed to be in 13 counties. And I just could not be at a more wonderful organization. Like Lauren said, I've been in the community for a while. I've had about 15 years at GHS, which is now Prisma. I've worked at Spartanburg Regional. Most recently, I had the wonderful opportunity to work in hospice, senior health, and palliative care. I did a lot of education in the community with physicians and also with associates. I was able to get certified as an advanced care planning facilitator last year. And my background is actually in public health. And I also have an MHA from MUSC and an MBA from Clemson. And so have had a wonderful career in education as well as healthcare. And I just want you to know that no question is out of bounds. And definitely, I know that Lauren and Camber are going to be helping me to monitor the chat room. But if you have a question at all, do not hesitate to ask that question or ask, at the end of the presentation. Although there is so much information available about the benefits of hospice care, many misconceptions still exist. And so the whole premise behind this presentation is to debunk those myths and to provide an accurate picture of how hospice can truly benefit you and your family. Okay, the first myth that often is brought up in conversations is that hospice is expensive. Hospice is fully funded. It is a fully funded Medicare and Medicaid benefit. And so one of the first things that I talk to families about when they say, gosh, I just don't think that I can afford that, is letting them know that once an assessment is made, talking to the family about, how we can help with your needs. Supplies are covered, particular medications are covered, medical equipment is covered. And oftentimes families have been funding different things. Maybe it's chuck pads or pull-ups, Ensure. Maybe they, were renting a hospital bed or a wheelchair. There's so many different things that the hospice Medicare benefit actually covers and becomes a huge help financially for the family to bring up. But again, that number one barrier, thinking that hospice is too expensive, is actually ends up for a lot of people being a really surprise and that good news that it is a fully funded Medicare benefit. Once you're on hospice services as well, we'll talk about this a little bit later, you would have also a social worker to help you with anything non-medical. So there could be even other things that you didn't realize that there could be grant funding for, or just an application that we could help you with. The next thing is hospice is only for the last days of life. This is a really big misconception, and you'll hear me say it over and over. The truth is that oftentimes people wait too late to look into hospice care for their loved one. Patients actually will real nursing care, of course, the medical equipment and supplies related to their illness. People actually, just like Tanya had said, can graduate out of hospice. It is your choice to, to be in it, but we would be monitoring you. They actually say that when someone enters hospice care, not only does their quality of life become better, but they actually tend to live longer. I know for a long time at my own church, if you would say someone was entering hospice care, they would think, oh goodness, like they just have a couple of days left to live. In actuality, over multiple years of research, average length of stay, now of course nobody knows when your last day may be, but the average length of stay is nearly 3 months long. And so again, hospice has been known to help extend life as well as really enhance that quality of life at the end of life. Another myth is that hospice is a place. Hospice is not a place. It is actually the care that is focused on comfort and pain management. And it happens wherever your loved one calls home. So if your loved one wants to stay at home or say they are in an assisted living community, that is where hospice can take place. The fact is, it is, again, provided anywhere the patient calls home. And often it is that patient's home or a family member's home where we can provide that support of having a provider, a nurse practitioner, a nurse, a certified nursing assistant, and again, a social worker or chaplain support. All of these different disciplines will come to where you call home. So you won't have to travel out to that doctor's appointment any longer, because I know for a lot of our families, it was really a struggle to be able to get out to that doctor's appointment. All of those disciplines would be coming to your home instead. Another myth, hospice is scary. Hospice isn't something to be feared. Hospice doesn't treat the illness, it maximizes the patient's quality of life in the final months. It addresses the spiritual and emotional needs of the patient while providing comfort. And I think that's something that everybody wants for themselves and for their loved one, is to be pain-free and to have comfort. Again, the goal of hospice isn't to cure the underlying disease. It focuses on symptom management, pain control, and comfort so that the patient can enjoy the highest quality of life possible during whatever time remains. Hospice care, again, also provides counseling and just practical support, and can also provide respite care. Excuse me. One of the things I'll mention, when I worked for a medical director in hospice care, oftentimes he would not even use the word hospice in the initial conversation. He would only address first all of the resources that come with hospice. Well, what do you think about having your provider or your nurse come to your home every week? What do you think about being able to call us, to call Wren Hospice 24/7, any time of the day or night, on weekends, on holidays, if you have a question? What do you think about if we help to provide you the medical equipment that you need, the supplies that you need, the soaps, the lotions, the things that can help your loved one be comfortable? What if we provide a social worker that can assess other needs that you might not have realized that we could help you with? And our chaplain also could come and visit you, not just for your loved one, but for your family, to provide that spiritual support. And then oftentimes the family would say, this really sounds like a great resource. And then our medical director would say, well, these resources, this program is actually called hospice. Because oftentimes, sometimes once you say the word hospice, the quote H word, people get scared, people stop wanting to talk about it. But when they hear all of the different things that come with that hospice benefit, it's not so scary any longer. Another myth, hospice means you are giving up. Hospice isn't about giving up hope. It's just redefining hope by helping patients to restore relationships, find peace, spend time with their loved ones without aggressive medical intervention that often can be very painful and potentially also very intrusive. The fact is, ultimately, hospice is not about dying. It is about helping patients to live life to the fullest with the time that they have left. And again, I said it earlier, hospice care, because you have that personalized treatment, because it has that ability to really remove a lot of stress, has actually been shown scientifically to actually prolong life, prolong the quality of life. Another myth that often comes up is that hospice is only for cancer patients. Hospice is a special kind of care for anybody living with any serious illness that has been diagnosed with 6 months or less to live by a doctor or a specialist, if that disease process follows its natural progression. But again, nobody knows when our last day will be. If it's tomorrow, if it's a year from now. People can actually even be on hospice care longer than 6 months. I know families that have had a loved one on hospice care for more than a year, and they continue to receive the resources and the benefits that come with being on hospice care. So if you have a loved one that is suffering from, and I can name so many different disease processes, whether they've had a stroke, dementia, Parkinson's, MS, liver disease, heart disease, the biggest thing is to look into whether or not they are eligible for hospice care. And even if they're not eligible at this moment, making those plans for what the next steps will be. I always, no matter where you are in any kind of disease process, I always encourage an education to happen, because that education, that discussion about hospice or end of life is so much easier around a coffee table or a kitchen table before your loved one is in a place where they need immediate resources. Another myth is that hospice care ends with the passing of the patient. We actually have both bereavement and grief support that happens even a year after your loved one passes away. If they still need spiritual support from us, it's not like they just get dropped. We have so many wonderful stories of how families became close to. We had a really great relationship with our staff, with our chaplains, and just know that once you're part of the Ren Hospice team, you will, and Ren Hospice team, Ren Hospice family, you will always be part of our family, regardless of how long it is, because everyone knows how grief can be. It can come in waves, it can come at different times, and we're always just a phone call away. So don't ever think that, once your loved one dies, then there's no more relationship with us. There will always be a relationship with us. Another myth is hospice means I'm giving up control. Choosing hospice, excuse me, is not giving up control. You will always be the driver of the bus. We are just riding on your bus. And so whatever wishes that you and your family have, this is when communication is so key, because we want to be able to help you with whatever your wishes are and help your family as you are going through this time. Patients and families make the final decision always. and there's always going to be that discussion. Patients also can revoke hospice at any time. It's always going to be your choice. So once you're on hospice doesn't mean that you can't come off or you lose benefit in the future. You can choose to come off of hospice, or you can get better. There are a number of people that do get better, and then they can come off of hospice, and when they need us in the future, they come right back to us. Another myth is that hospice is an easy choice. And we know that, especially when you have a loved one that is going through a difficult diagnosis or a difficult situation, that it's not always an easy choice. And that's why we always want to be there for education. If you need to talk to one of our nurses, or if you want to talk to someone on our team, or if you want to talk to our chaplain, we are there to help support you as you make that choice for hospice care. Wonderful. He would always talk to his families, and he would always kind of put it in a story. He would say that there are always two groups of people. So picture this. Picture that you're on a boat like the Titanic, and there is a big hole in the hull and water is coming on board. There's going to be two camps of people. The first camp, they are going to roll up their sleeves, and they're going to grab buckets, and they are going to bail that water all the way until the very end. The other group of people, they are going to move their chair on the deck. They're going to get a pretty drink. They're going to relax, and they're going to not bailing water, but they're going to enjoy that drink. And both of those camps are completely correct, because it's what the family wants, it's what the patient would like, and we are there to help support that decision, no matter what that decision is. And so again, I always encourage people, because it's not an easy decision, to come to talk to us, to schedule time. I've done Zoom meetings where a family member is here in the upstate and a family member is in another country, even, to talk about what's happening, so everybody is on the same page. So another question that I often get, because these words oftentimes are new to people. So what is the difference between hospice and palliative care? Because oftentimes the myth is that hospice and palliative care are the same. So what do palliative care and hospice have?
Hey, Gina, hold on one second. Gina, can you hear me? Gina, can you hear us? She seems to be completely frozen now.
I'm sharing my screen again, and let's see. Can you see the
You're good.
myth? Okay. All right. So because these are new terms for a lot of people, oftentimes people have not heard the term palliative care ever, is kind of what I often will hear. And so a lot of times people think that palliative care and hospice care is the same thing, but actually it is not. So first, let's address what is in common. So what's in common between palliative care and hospice care is it is comfort care. It does offer a higher quality of life and helps patients and loved ones cope with the disease process that they are in. Palliative care, however, is at any stage of the disease, while hospice comes in when there is a prognosis of 6 months or less if the disease process takes its natural course. In the past, even, you had traditional medicine, like where you go to the doctor, you get treatment for medicine, medicine, they follow the disease process, and then they start palliative care, and then it could go into hospice care. Nowadays, they actually start the palliative care discussion a lot earlier, and with anybody that has a diagnosis of a chronic illness. So in some cases, I'll just use congestive heart failure as an example, because that's what my dad had gone through. Once he got the congestive heart failure diagnosis, they referred him already to a palliative care specialist to help him through that. Different hospital systems do it different ways, but oftentimes with specific chronic illnesses, once that diagnosis happens, an immediate referral to palliative care starts. That wasn't how it was 20 years ago. So again, all of hospice care is palliative care, but not all of palliative care is hospice care. Okay, so let's talk a little bit about how hospice works. We talked about it a little bit earlier. Medicare pays for hospice care for people who are terminally ill with a life expectancy of 6 months or less if the illness runs its normal course. I know that that definition sounds kind of, muddled, because no one knows, right? Nobody knows how long. No one can actually determine how long someone is going to live. But again, the core of how hospice works is to help provide that whole care for your body, your mind, your spirit. One of the things I want to mention again is that the biggest barrier with hospice isn't that it focuses on end of life. It's the fact that most people actually choose it too late. This is actually a quote from the executive director of the Brookdale Center for Healthy Aging at the City University of New York. But it's something, honestly, that I have seen firsthand myself, that people oftentimes don't get the benefit of having potentially months of support by a chaplain, even if you already have a home church, but having another level of spiritual support, or having a social worker. It could be so daunting, all of the different resources, senior health resources that are out there. But to have a social worker be able to talk to you about, what some of those needs are, maybe even some needs for the family, and having them to do that legwork for you. Say you're at home, but you're wanting to go to an assisted living facility, and you have a certain amount of income from social security or pension or whatever it is. They can take the information that you give them, they can do the legwork, and then present you with 3 options. That oftentimes can be so difficult for people, and it's overwhelming because there are so many choices out there. Or maybe you just need help with a non-medical home sitter. Again, the social worker could help you figure out, a company that could help, with that. Maybe you want to apply for some grant funding from ACOG to have support helping to pay for that non-medical sitter. And that's it's not a difficult process, but it's time consuming, and you already have other things that you're trying to take care of. Our social workers could help with that, not to mention all of the support with grooming and bathing that our certified nurses, assistants can help at home. I know when I think about my own parents, they were both aging. My mom, very, very strong. I mean, she's 81, still runs 5Ks, but to help my dad shower or bathe, it was very difficult for her to do that. She was a lot smaller than my dad. So to be able to have a CNA come and help with grooming. And she was still part of the process. It was just also another set of hands to help. So again, don't wait, at least come in, get an assessment, because even just us becoming your 911, our phone call away 24/7 was a huge benefit to a lot of families. So earlier referral to hospice helps better manage symptoms. I know with a lot of doctors, I mean, I think, gosh, I had been going to my primary care physician for more than 20 years. I was going to some specialists for more than 20 years. They saw me often, but they didn't see me every week. And so imagine having that support at home where you are being seen by somebody, every week, maybe even more than one time a week. But again, having that direct access to call and ask for a question, any questions. So better management of symptoms, stabilization of your condition. We talked about it already. Having that personalized care can help prolong your life, but not just prolonging life, but a better quality of life. Reducing physical, emotional, and financial worries. Again, having that chaplain support, having that social worker support can help you with all of those different things. And then overall, also reducing family stress. So what are those steps to getting hospice care? Call us, call me. We'll set up an initial assessment or have that conversation with your doctor, and your doctor can write an order to assess for hospice eligibility. That's not saying that he's putting you in hospice. That is just saying that we're going to come in and assess if this is the right time for you for hospice. And then what happens next is a member of the Wren Hospice staff will come and collect information. If we don't have a doctor's order, we have a HIPAA release form signed, and we go and we collect your medical records so our clinical staff can evaluate where you are and evaluate if you are eligible for hospice services at the current time. And then a member of the nursing staff would come and do a face-to-face assessment. Again, not to say that you would immediately come onto hospice, but it helps in the planning for whatever is coming next, planning for those next steps. Okay, so I know that I went through a lot of information, a lot of different myths, a lot of different things that you might have been thinking about and you might not have been thinking about. So what questions do you have? I'm going to stop sharing my screen, but I will be sharing these PowerPoint slides and some of the notes with Lauren and Camber. And so if you would like a copy, of some of the notes and the slides, they will definitely come your way. But what questions do you have for me today? And if it's something that I cannot answer or you'd like a clinical person, I'll definitely record that and get your information and get that response to you.
Well, first of all, thank you so much, Gina. That was perfect. I think that was exactly, what we had talked about. And I think you covered a lot of what people's concerns are. So I really appreciate you taking that detailed time. But as Gina said, are there questions? You can either unmute and ask, or you can put it in the chat.
Could she put her telephone number back up?
Sure. Can you all see that?
Yes, we do, Gina.
Okay,
Thank you.
perfect.
Yes, fine, thank you.
Yes, and I love people. I love to talk to people and to understand, what their concerns are, what their expectations are. So whether any of you call me for yourselves or for a loved one, again, there's no question that is out of bounds. And like Lauren said with her parents, I just feel like knowledge is power. So if you have a loved one that doesn't even live right here in the upstate, but I can help them with the knowledge that I have, don't hesitate to ask. Because again, I feel like no matter where you are, I mean, I know that my family is up in New Jersey and New York. It's one of those things, if there's something that I can help you with, I would be happy to help you with it.
You mentioned respite care. What is that?
Okay. So when you are under hospice care, there are different levels of hospice care. So the first level is just those routine visits. When I talked about a nurse coming, a CNA coming, the different disciplines coming to your home. Well, there could be a situation, and I'll use this actual two real life situations that I'll share. When I was working in Spartanburg, there was a family that was having a big family event, like a graduation. And the daughter, who was the primary caregiver for the patient, really wanted to be able to go to that family event, but did not want her loved one to be without care. So we can actually schedule this and contract with a local hospice home to have your loved one in respite care while you are attending that family event. And so they'll be getting that 24/7 care while, for instance, in that case, the daughter just wanted to, be, that family member at that event and not just the caregiver, but she wanted peace of mind. We had another situation where the patient said, I really need a break from my daughter. This is a different family. And I think we need a break from each other. So we were able to schedule and provide that respite break at a local hospice home so they could have that break, from each other. So that's basically how respite care works. Now, in other situations, we have had many families moving to the upstate and moving their loved one on hospice care to the upstate, but they needed to have, their loved one in a safe place while the moving truck was actually unloading and they were getting the house set up. That was a little bit different. We have multiple facilities in the area. I'm thinking that Harmony, chime in, that you also provide respite room stays, and that would be an out-of-pocket stay as opposed to what we had talked about, just a couple of minutes ago. But many of the facilities in the area, they all have different requirements. Some might only, provide respite minimum of a week. It could be minimum of 30 days. But you can also pay for an out-of-pocket respite stay if you are not currently on hospice or you're coming on to hospice care.
Good. Okay. Anybody else? Any further questions for Gina while we have her expertise here? All right. Well, thank you again, Gina, for your time and everybody for being here.